take our phone lines where
Yeah.
we've got the new chair of the Governor's Physicians Advisory Group, Dr. Nathaniel Berg.
All right.
Good morning, Doc.
Good morning, Doc.
Good morning.
Thanks for joining us. I know your time's pretty precious, so we're just going to get right into it. I think one of the big questions that people have is when the governor suspended face-to-face learning, the numbers, hospitalizations, and all that. Well, they were very alarming, and her reasoning was that it was only a matter of time before community spread hit the schools, and that we'd have to keep the students safe. I'm sure you're aware. Several weeks later. Conditions even worse, but we're going back to face-to-face. So if you could, we'll just give you the floor. Kind of explain the logic in that the governor called off face-to-face when things were one way, and now they've only gotten worse, but we're sending kids back to school.
Sure. Well, I think one thing is I'm not going to say correct you, but I want to make it a little clearer exactly what the governor was thinking when she decided to put a pause on schools. And indeed, that was the language that she used, was to put a pause on face-to-face learning while we analyze, do a little bit better analysis as to why our numbers were going up so quickly. And pausing was the right thing to do, and keeping them closed while we still collected some data was, it ended up showing us that it is community spread is the cause of the numbers going up. It wasn't the schools. Kids were not bringing it home, and I think, as you just described, when the pause was pushed and we saw what happens if there are no kids in schools, the numbers went up anyway. One good thing I want to mention about that is that the kids, although we have more kids turning positive, and this is a worldwide assessment, it's not just on Guam, is that fortunately children, even though they're not vaccinated, who do develop COVID, who become positive, do not get as sick as adults who are getting with the Delta variant. That is, that the England, which had the United Kingdom, the Delta has already run through, and they found that there were a larger number of children getting COVID, but they weren't getting any sicker than they were with the previous, let me call it the original type of virus, the non-variant type. So we are seeing larger numbers of kids being sick, but they're not, there's only, for example, only one kid in the hospital right now. Although that's bad, that's about where we've been sitting, where we sat before with the old non-Delta variant, the regular old COVID. So the assessment of both the Physicians Advisory Group and all of the advisors was that schools, so long as you decreased you took all the mitigation efforts, sort of turned them up a little bit, if you will, make sure that there's proper mitigation in every single school before it opens, that the amount of additional community spread should be minimal, and that the danger is not to the kids themselves in school. That's really not where the danger is. The danger is in the non-vaccinated at home getting sick and spreading it. We're seeing that I've heard the ER docs and the ICU docs call them success stories when people are getting admitted to GMH who they come down, there's a COVID case, and they find out they're vaccinated. They know that they can assure that patient that there's an extraordinarily high likelihood that they're going to do just fine. They're going to get supportive measures like IV fluids and maybe antibiotics, but they're going to go home in a couple days. It's the overwhelming numbers that were a problem for us in the hospitals. That's beginning to get slightly better, but we're still needing to cut down on the number of people who are getting sicker. That is, the people who come in unvaccinated, they end up taking up more resources and end up taking beds that could be used for everybody else, for people who come in. I mean, I just read a tragic story of a kid who went to the ER, not here, and because there were so many people with COVID, again, mostly minor illnesses for those who are vaccinated, and more significant ones are almost every one of them are non-vaccinated. They were taking up so much effort in the ER that the kid sat with appendicitis and his appendix ruptured. That's what we don't want here. We don't want it that you go to the ER and there's no bed for you, un-COVID, not COVID related. I think you and every listener who's been on Guam for more than a little while understands that our system is always stretched with regard to the number of beds that are available. So we don't feel that putting kids back in school is going to put the kids in danger. They weren't in danger before. It wasn't spreading in schools, and that's public health very carefully assessing the data, saying it's not the kids that are spreading it in schools. It is a community spread. We saw that when the schools have been closed now for 3 weeks or so. The real effort needs to be towards getting people to be vaccinated and to understand that the previous, and I'm not someone who takes away freedom of choice lightly. I don't like this idea of what Governor Schwarzenegger said of, I'm not even going to repeat it, but that said, he didn't care about, quote unquote, your freedom. Nope. I do care about your freedom, and I want you to have that choice, an informed choice. And if you don't want the vaccine, then you don't have to have it, and we'll take measures to deal with that. But what I'm appealing to people is to realize the impact that that choice has on our entire community. That if you do get COVID and you think I'm 50 years old, I'm 60, I'm 40, and I'm doing just fine, the risk is real that the Delta variant can cause people who were otherwise doing just fine and think they're healthy to end up taking up ICU beds and being in the hospital and taking up huge amounts of resources. Also, we're trying to slow down that spread in general, and people who are not vaccinated spread it more easily. That's absolutely clear if they get it. So it's not a fight against vaccinated or non-vaccinated. It's not that we want to split this into some sort of anti position against those who aren't getting vaccinated. It's merely saying, can you please stop and listen? We know people have made that decision, but informed decisions, meaning getting informed. And what we're saying is not getting vaccinated poses a great threat to this community, not perhaps to the individual. And the individual can smoke cigarettes, and I'm still going to be just the same sympathetic I am to them if they get lung cancer versus somebody who never smoked. That's our job, is to care for every single person with whatever condition they have. And I don't think anybody gets a negative word if they come in that is non-vaccinated and they come into the hospital. We care for every single person that comes in. The issue is we're asking people to make an informed decision, and that part of that decision is, how does this impact your family? It's maybe your uncle who's not going to have that hospital bed when he or she shows up. He, in uncle's side, shows up at the hospital. It's kids needing pediatric beds. Right now, we're okay, but the minor illnesses could potentially lead to more kids being hospitalized. That's what we're seeing in the States. So we're trying to slow down that spread, and if you're vaccinated, you spread it less. That's basically where we are. So we think it's safe to open schools. I will tell you, Chris, that I hear people saying, make up your mind. And I saw that one comment, and I thought, is that what people want us to do, is stick to our guns? No. I think people want us to very quickly assess the data. We're meeting every single day. And if new information comes in, new treatments, or treatments not being available, or data finally being assessed, or comparisons to other communities that we've been able to make who face similar crises, they want us to react quickly. That means that things may change quickly, but that's good. It means we're not saying we're going to keep the schools closed and then not assess the data. Or, in this case, I think people do need to be prepared. If the data shows that opening the schools somehow is making community transmission go up, of course, we'll take that into consideration. We're looking at the numbers every day, and the schools may need to be closed again. But nationwide, there's a huge effort. The public health experts nationwide are strongly encouraging to make every effort to open schools up. And if we're open up 2/3 of the time, that's better than 0/3, I guess.
But Dr. Berg, we're also seeing stateside schools closing in the midst of the surge. I just want to go to what the Superintendent of Education, John Fernandez, had said. He described the situation as we're reopening schools in the middle of a high-risk situation. And so you're basically saying that we're opening schools, the PAG believes it's safe, because if your kid gets COVID, they're probably going to be asymptomatic.
Not necessarily asymptomatic, but they generally there's a good chance they'll be asymptomatic. But if they do get sick, we're seeing minor illnesses. Kids with comorbid conditions, people need to be really careful with that. That is, if you have a child who has another significant illness, maybe you want to talk to you should talk to your pediatrician as to whether face-to-face learning is right for that child. but for the vast majority of children, the risk is not. There is no significant risk that we see as in a population. That is, of course, every child, there's a small risk a child could get sick, but it's not the children that pose the risk for true health concerns right now. No, when he says it's high risk for the community. That I can't speak for his attendant, but it's a community that's at high risk. It's not the kids that are at high risk.
But Doc, the reason why the governor suspended face-to-face transmission was because of the situation in the community.
No, actually, yes, that is true.
Yeah.
It was partly to look at whether or not the
but that's not what she said.
Significant contributor.
She said that it was.
She did.
She said it was because the spread was so rampant in the community. I
think we're actually saying the same thing, but those sentences have to be linked.
Okay.
The community spread was very widespread and going up,
right.
And what we all thought was close the schools and see. Because that's the only way we're going to know.
Okay, this is what she said. She said, while data at this time does not indicate the existence of school clusters, I am being proactive about the eventuality of spreads in our schools. I'm receiving messages and calls concerning the fears and anxieties that our parents, teachers, and students are facing because of the increase in positive cases. I recognize that our children's education is critical, but my concern for the protection comes first.
Yeah, and so that's exactly what she said. Those were her exact words, Doc.
Yeah, if you listen to that, what she's saying is we had no data at that time to show that it was spreading in schools. We closed the schools, or she closed the schools, so that we could indeed take a look and see. She said being proactive, meaning looking to see, is it coming from the schools? I think we all saw that with the schools closed, the numbers continued to rise. It wasn't coming from the schools. We don't see any evidence that the community spread is because of schools. We didn't know that at that time. And I agree, everybody agreed with her, or I think, the majority of the people with whom she's sought advice agreed that shutting down the schools or pushing the pause button until we figure out our schools a significant source of spread, and what our data and the analysis, to the best of the data, to the best analysis of the data that is available, said the schools are not the source of the spread. Mm-hmm. So it's, even though the numbers are going up, opening schools is okay. Now remember, in other communities, the hospitalization situations were different with children. That is not, children are, in other words, when you said some schools are closing around the country, but the majority are not. The majority are open and keeping the schools open with mitigation efforts. Many schools, counties and districts that didn't have mitigation efforts in place, a lot of them where they didn't have masks, for example, I would say that would be a place that you should close schools because they could be a source of spread. Here, I think, remember what the governor has said is if the school feels it's ready, if the mitigation efforts are in place, then you can open. A number of private schools are saying we're not quite ready because the mitigation efforts that were recommended by public health, they don't have them in place yet. The Department of Education has said no, we're not quite ready. The Department of Defense, the DODEA schools have been open. They have not been showing, and many of the teachers and the students live off base. A huge chunk of them live off base and go on base every day. So they are not a mirror of our public school system or private school system, but it's pretty close, and they have not seen any spread within the community. I'm sorry, within the school community.
Doc,
not significant.
Can I get in and I want to go back to what you had said about kids with pre-existing medical conditions, asthma, obesity, that kind of thing. You said that parents might want to consider not allowing their children with those conditions to return to face-to-face instruction, which I think that's kind of big. But
no, what I'm saying is they should consult their pediatrician, consult their family practice doctor, their pediatrician, so that those decisions. In other words, what I'm saying is that the average child in the school system of Guam is not at a significant risk for themselves personally. They in other words, they could get COVID, they're not going to get very sick. What I'm saying is that those parents who have concerns, who say my child has asthma, if my child had asthma, they probably already have, but they should consult their pediatrician, their family practice doctor, whomever they seek for primary care, and ask them, do you think it's a risk? Because I, as the chair of the Physicians Advisory Group, am not in a position to make a broad statement. Every child with asthma is okay. But I suspect that if a child has mild asthma that's under good control, that a healthcare professional may say, that's okay. Your kid can still go, particularly if they're over 12 and vaccinated. But for smaller children and those who have more significant illnesses, I think it's important that parents feel comfortable when their child leaves their home and goes into a school environment. I do feel comfortable now, but I also feel comfortable that the governor and the team that she has around her are assessing it every day. So that if the data then shows, hey, actually it turns out now we are seeing spread, that we can stop it, right? But that fear should not counter the data that we have right now that says it looks to be extremely safe.
Yeah, I mean, but I think people can be afraid because you guys are telling us that it's serious. But it's interesting that what you're saying about kids with pre-existing conditions need to consult their doctor, because the Department of Education, the largest school group, is not allowing parents to switch to online when we go back to face-to-face. So what we're going to have here is a situation where a parent might get something from the doctor that says, yeah, I don't know, your kid, they get COVID, it's not going to be good. Parent says, well, I want to keep my kid home. So, but that option's not being given.
I don't think that okay, so I obviously don't speak for the Department of Education,
right.
But I suspect that if a child who is involved in face-to-face and they develops a more severe asthma, and their doctor or other healthcare provider says, hey, I think until we get this under good control, you're better off doing remote, I strongly suspect that the superintendent would tell you, of course that child on an individual basis would be allowed to switch. Fear should not drive it. I think that parents are uniformly concerned about their kids. I hope so, right? And but the fear of their child getting COVID at school, I think should be, I'm trying to reassure parents that if a child is a healthy child, your typical child, average child, without I hate separating kids out, but if you say your average child will do just fine in school, even if they got COVID. If, on the other hand, there are true concerns about your individual situation that have, particularly those that have changed since one elected in person versus home, not homeschooling, but you know what I mean, remote learning, then I think the school will listen. The school is not, the school's there to care about kids and to teach them, and I can't imagine that the school would say no if your child's situation, healthcare situation.
But that's their policy, Dr. Berg, is that if you didn't opt for online at the beginning of the school year, that you can. But had the governor mandated it, because a lot of parents are obviously.
I'm aware of that, Chris. Yeah. But I'm aware that the school cannot switch on a dime, if you will, whenever you want to take a 180 with a large number of children. And again, I do think this is a discussion that should be with the superintendent himself, because I can't speak. I'm merely saying that I would find it to be quite surprising if on an individual basis, due to healthcare related issues as supported by a healthcare professional, that they wouldn't give that individual child concern,
but
attention.
Where do
policy is there, Chris? I mean, the policy is kids have to go to school every day, but if a kid's sick, they can stay home. I imagine that this is sort of treated in the same way. Nope, you can't switch. Oh, wait, there's a significant healthcare concern. Can we give us the information, let us look at it so we can feed your child on an individual basis, right? I mean, they're policies, but I hesitate to say this, but I'd say, of course, there are going to be exceptions.
Mm-hmm. Well, as a parent, I'm still concerned about sending my child back into school, back into face-to-face instruction. But I wanted to ask you about the community spread and what's being done to control the community spread, because, as you know, the numbers are still triple digits, and it's been that way now for several weeks. And we did hear from your predecessor, Dr. Hoa Nguyen, who's been on here, and he's saying we need to implement additional restrictions, and quote, like now. And so I'm just wondering, do you not feel the same way? That we're good?
The restrictions, we consider restrictions literally every day. And I think there's a balancing act that is incredibly difficult. I think, my job is difficult, but doesn't compare to the governor who has to make those calls. Are we going to, and I feel sometimes she's never going to be in a win-win situation, almost never, because if you impose additional restrictions, there are going to be those who say, why are you putting in further mandates and restrictions on our freedom? And that can have a negative impact on the economy, on my kids' education, on all sorts of things. And then there are those who are going to say we need to shut everything down and protect everybody. That balancing act is difficult. It's like, to a certain extent, like setting a speed limit. You kind of know that on the highway that if you're driving 55, it's not as safe as driving 35. But we don't want to restrict speed limits down to 35 for everybody. I'm not sure I can get a great comparison, and I could be criticized for each one I give. But I think there's a balance, and I think she's looking at the numbers every day. The main number that we're worried about is hospitalization, right? How many are the hospital beds still available for people who need them? Are they there? The answer is yes right now, but we are close. And the main effort, quite frankly, needs to be to get as many people vaccinated as possible. Yes, it's spreading. Yes, there are tons of people with who are turning out to be positive, but the vast majority of them, if they're vaccinated or if their kids, are facing very mild illnesses, and they usually are not needing hospitalization. So what are the efforts that are being done? That's the real effort. We can't stop the spread. Even you close the schools, you shut down access to restaurants and other places where masks are being taken off, we still saw the numbers going up, and that's worldwide. Mm-hmm. But what we can do is implement treatment. And I'm telling you, we have very effective treatments. Mm-hmm. We're just waiting for them to come. It's nationwide. There's a shortage. FEMA is coming. The Regeneron COVID, this immunoglobulin that helps people stay out of the hospital. The vast majority who get treated stay out of the hospital. It's coming. The hospitals have tents outside so that they can hopefully, as I mentioned, some people just need IV therapy or some IV antibiotics and they can go home without getting admitted. Mm-hmm. So the hospitals are doing everything they can to keep those beds open, to treat people outside of the hospital, and the clinics themselves are showing an interest in how do we treat people with this Regeneron COVID. Right?
So Doc, it does sound like then you guys are just looking at the hospitalizations then and the vaccinations. So I want to ask you this because this was something that a viewer, our online viewer posted, and hopefully you can give me a reaction and if this is in fact what is happening. So I believe the governor and the PAG are not choosing to lock down because ultimately they are hoping for natural immunity from natural infection to take place. Studies are already showing that natural immunity is just as effective, if not more effective, in protecting against severe illness from COVID as also getting the vaccine. Therefore, with the 80% vaccination rate and natural immunity, we should see an eventual drop or leveling of hospitalizations. Unfortunately, the downside to this is that there will be some who will experience severe illness and even death from infection. But in the long run, natural immunity and vaccinations will lead to what's called an endemic, which is when the virus is no longer as lethal and deadly as it used to be. So is this kind of what you guys are?
That sounds, I wouldn't say it's a plan per se, but ultimately that description is not far off, which is that as long as we can keep people, I don't like the part, it is true that unfortunately some people are going to get sick, but that's going to be predominantly the non-vaccinated, almost exclusively. Not all, there are exceptions, but almost exclusively that it's going to be the non-vaccinated. That's why we're trying to encourage them, saying, hey, look, you're taking a risk that you don't need to take, and unfortunately spreading it more so. But yes, ultimately, once there's been a combination of exposure and natural immunity and vaccination, we will win. We just have to pray, because there's nothing else you can do, that there isn't the new Q variant that comes along. We hope that this will be the end of it.
But Doc, so basically you're saying that the play here is, and why we're not seeing any additional more evenly applied measures across the board, is because you guys are just letting it spread and watching the hospitalizations? No.
Chris, that's not fair.
No, that's exactly what you just said, though.
What I'm saying is that hospitalizations are the critical thing. We don't want people to die, and we don't want that's why we're saying please get vaccinated. We're also saying please, if you do elect not to get vaccinated, to try to do everything else to keep your comorbid, that means your other illnesses under control, to keep your blood pressure under control, keep your diabetes under control, exercise, eat properly, all those other things that will help you not get as sick if you do get COVID. Stop smoking, the usual health things that we all know, those need to be ramped up if you do elect not to get vaccinated. So no, we are making efforts. The effort is indeed to stop people from dying, Chris. That's what we want, is to stop people from dying. That means that we keep hospital beds open for those who need the hospital beds, and we do everything we can to keep everybody who does develop COVID out of the hospital while making the most sincere effort we can to prevent people from ever ending up in the hospital, which is through vaccination. We know that as a side thing that's going on, that it is spreading out in the community. We know there's community spread, but that we're trying to do everything we can to minimize the impact that has on the community. I'm not saying that's our plan. I'm saying we know that that is happening, and we're making every effort we can to slow down that develop of an endemic virus. We're doing everything we can to slow down the negative impact that has on our community as a whole. And again, reiterating, keeping people out of the hospital, preventing people from ever getting there, and trying to keep those hospital beds open by treatment for those who do develop illness.
So again, what's being done to slow down the spread?
Okay.
Aside from
the spread itself is encouraging the vaccinations, and the
but the vaccinations it's not bulletproof.
No, we know that, but it stops the vast majority of people from getting serious illnesses. And if people do get significantly symptomatic, we have treatment that is coming on the island shortly, and we are working every day. We met with the regional head of the Health and Human Services on Tuesday, who is here meeting with the governor's office and with the PAG, I might add, assuring us that we are going to get fresh supplies of this immunoglobulin, so that if that bulletproof shield doesn't work and the person gets injured, it's much like a bulletproof a shield that police officers wear. They can still get injured, but they're not likely to die, right? So it is not bulletproof, but it's like the vest that police officers wear. Nope, they can still get shot, but they hopefully won't die. And then we have efforts to treat those who do get so-called breakthrough illnesses. We have things we can do to decrease their need for hospitalization. And I think you'll begin to hear those stories out there of people who came in very sick, vaccinated and non-vaccinated, but predominantly non-vaccinated. They got treated with this immunoglobulin, mostly now up at GMH and GRMC, and got better and avoided hospitalization. There are a large number of people on Guam who avoided it and maybe prevented them from dying. I can't say on an individual basis, but those who were very sick got this immunoglobulin and felt better and were able to go home instead of to the hospital. The limiting the capacities in the restaurants where people are communally taking off their masks, that also is helpful. All measures are looked at and balanced as to how much of an impact we think they'll have, and then the governor ultimately has to make the decision as to which restrictions are appropriate. Mm-hmm. Kids in school, we don't feel is at all likely to be a major cause of community spread. We just don't. And we don't feel that they're likely to be I'm going to call it a problem with regard to being hospitalized. Very few kids are getting hospitalized.
Doc, I mean, outside of telling parents don't be scared, do you think that if they are afraid because it's serious and because they look stateside and they see, hundreds of thousands of pediatric admissions, that they should be given the opportunity to keep their kids on an online mode of learning when face-to-face resumes?
Okay, so I would say I don't feel that I'm the right person to comment on that. I feel that if the kids have significant illnesses... But
I mean, you're making these... You're helping advise the governor to make these decisions, and we're resuming face-to-face, and your advice to parents is don't be scared.
It is. It is my indeed that the average person is that fear should not drive that face-to-face learning is the best. And if there are concerns, I'd much rather address those concerns. Same as Chris, the people that say, I don't want the vaccine, that I would say, well, you should take the vaccine for the majority of people, right? There are exceptions. And I do say for most parents, yes, my advice is your child will do better with face-to-face learning. that the fears need to be addressed for each of the parents. I understand people having concerns about their kids going to school, but I would also say that those concerns from a medical standpoint I understand them, but I'm saying we don't have a significant concern about typical kids who don't have other significant illnesses getting sick. They could get what would appear like, I'm really crazy reluctant to make this comparison, but they can get what can appear kind of like a flu or even a bad flu, which is typical how kids experience COVID who are otherwise healthy. Let me make sure that again, that I emphasize that, who are otherwise healthy, they do just fine. They come in, if they do go to the hospital, they're in for a short period of time. So I'm not worried about my children going to school, and I would encourage other people to not necessarily follow my lead, not that I'm the person to follow, but that the majority of healthcare providers, the vast majority of healthcare providers, do not have concerns about their kids who are otherwise healthy having face-to-face learning. I don't know what else we can do, Chris, except to try to reassure parents. Fear should not drive it, but that really is a Department of Education issue, not us. No, I'm saying that our advice is that that parents should put their kids in school, but as to how that's done through the Department of Education, that's really way beyond the scope of my
I just think it's a hard
position.
sell, Doc, because again, when the governor paused face-to-face, things were bad, but I didn't think they were going to get worse, and here we are, and we're resuming face-to-face. So I just think for parents out there, it's almost insulting for you to say, don't be scared, don't worry about it. Because
notice, Chris, I didn't use that tone. I'm saying
I know, but
push the pause button to allow us to assess as to whether the school spread was significant. We feel it's not. We're keeping an eye on things very closely. We don't feel that individual kids who don't have significant other other illnesses, comorbid conditions, what we call them medically, if they don't have other significant conditions, that it's safe to return kids to school. That's our job, if you will, is to come down and make a decision as to when we feel it's safe for kids to go back to school. We feel it's safe, and that is the governor's decision, and it's one that's based upon not out of the blue. It's not like, it looks good. I don't mean to insult you about that either or mock you. I'm not doing that. I'm saying it wasn't like that she said, okay, how about now? We we took another pause last week and said schools have to have another week or so to get ready, but then at least let those that feel they've got the mitigation stuff in place, let them open. And then other schools, as they get those mitigation efforts in order, they can open. And as you will see, a large number of private schools have elected, or at least some, I know of some, have elected not to. They're not quite ready yet. And we're supportive of that. We're not saying go and open. We're saying if you can have your mitigation efforts in place, go ahead and open. We'll keep an eye on things on a daily basis, but it is important for kids to get back in school, and it's okay to do it now. We feel it's okay. That's a tough decision, Chris, but the decision was made. We're very carefully assessing it. We're not flip-flopping. The governor was right to push the pause button. She might do it again if the data supports it. It's a time when rapid changes, they're everywhere. Every place in the country is making rapid changes, saying things look good. 2 weeks later, they're saying, no, looks like we need to, say, shut down bars, or because bars are a source in their community, or restaurants seem to be a source in our community. And last week they said they can stay open. This week they're saying closed. The HHS regional director said it's happening all over. In California, he said it's every day one county says, nope, not here. And then a week later says, okay, you can have restaurants, but only outside. They're trying to use whatever data is available in their own individual community. And that's what we're doing to the best of our ability. We're open for criticism. I mean, I know that when I took this position on, I might as well and said, Target isn't open on Guam, but there's one on my back, right? And I get that, and I get that our decisions are going to be. There's no way our decisions are going to be supported by everyone in the community. But I do want people to know we do put a lot of time and effort into thinking them through, and ultimately the decisions are based upon well thought out dialogue between our local experts. I'm not the expert. I'm just the person who kind of represents the opinion of the PAG as a whole. So it's not me who is making the decision. It's not me who's telling you my opinion. I'm trying to consolidate the opinion of all of the members of the Physicians Advisory Group, and then also what I get from the governor's other advisors to try and come out and explain why we made our decisions. But sometimes it's like going to court. You're with a judge. Someone's going to lose and someone's going to win. We just hope that the right party, that we make the right decision, just like every judge does. But we reserve that right to change if new data points otherwise, says that maybe we need to change that decision. It's a tough one, Chris. I can't tell you that we know everybody's going to be happy, that we can allay everybody's concerns and fears, because we're all individuals. But I do want people at least to know that we're doing our best to make the right decisions, and it's not willy-nilly. It's not no decision is made without it being well thought out. Even over the last few days, we rethought it over and over before the governor made her final decision, which is the final decision for now. Please understand that a change is not a flip-flop. It's what you want. You want our governor to react to new data, not just to say, I made my decision and stick with it. Not as new data says that something needs to change.
I think the old data is pretty scary already. Oh, I'm not scared though.
Yeah. I mean, so this is it, right? Hospitalizations, we got to keep that down. Everybody go get vaccinated, even though we're at 83%. And the triple-digit positives, we're just gonna
roll with it.
Not roll with it. We're gonna do everything we can to slow it down.
Like what?
Everything reasonable. Well, as I've said, the mitigation.
Don't say hospitalizations again.
No, I'm not. I'm
saying, wear your mask, wash your hands, practice social distancing.
To an extreme is what I'm saying. Yes, be really cautious. Wear your mask, social distance. Don't go out as much as you might have before. Self-limit. Do what you can not to have big gatherings where people aren't wearing masks. We can't control what people do at home and in their backyards. But we're saying now is the time to kind of limit that, to say, you know what, let's put off that party. If one of my kids or my brother, if it was his birthday tomorrow, I'd say, let's put off that barbecue for a couple weeks here. Let's not have a whole bunch of people over not wearing masks and having beers by the barbecue as usual.
But it's not. It hasn't been working though. We've been saying that now.
No, actually, I believe it has.
But
the numbers are going up all over the place. But
I'm talking about on Guam though.
Yes. I would argue that it probably would have been a lot worse. That the numbers could have been a whole lot worse if we hadn't slowed down and put in the mitigation efforts that are already there. That if the community had not been, if you will, educated or reminded, maybe is a better word, to saying, please pay close attention, get tested, get isolated. The testing numbers are helpful for us. Those people who turn positive are staying home, right? So that if you want to talk about increased testing and encouraging people to get tested frequently, if they get tested frequently, get tested if they ever think they've gotten exposed, that allows them to go home and stop themselves from being a community spreader. So no, those numbers that we're seeing also reflect a positive thing, that we've been able to identify them and get tested, right? We're testing at a much higher rate than the vast majority of states. So the concept that we are quote-unquote number one, we're also close to number one in terms of our testing per capita. So we find people who are positive at a much higher rate in our population than other communities. I'll give you Iowa, for example. It's only testing 80 per 100,000. That would be as if we did 200 tests a day, and we're doing a whole lot more than that. We're doing sometimes 500-600 tests in a day.
Mm-hmm. Dr. Berg, we have a question from one of our online viewers, and we actually do see this on the JIC report every day, about the unknown vaccination status in the hospital. Why wouldn't GMH know that?
Well, people who come in?
Yeah, that are hospitalized, and it says unknown vaccination status.
Okay, so I'm going to, unfortunately, have to kind of speculate here, because I think that the hospital will be better able to answer that. Mm-hmm. But if people show up as, quote-unquote, John Doe, we don't know their statuses, and that happens. And also people who may have been traveling, and someone says, I'm pretty sure that person got vaccinated because they didn't go to quarantine, but they don't have the card on them. It has to be presumed that until we know that they were vaccinated, until they can provide some sort of evidence, and remember, people sometimes have I'm not going to say a different name, but you might not believe it, but when people even come into our clinic, for example, they'll write their name down, but then when we take their driver's license out, it's a different name. And they'll say, oh, yeah, I'm sorry, I got married and changed my name, or I got divorced, or I now go by a different name. And so when you try to look into the database in Guam, they might have presented their driver's license, but when they showed up at the hospital, they didn't have the driver's license, and someone gave a name that is also used. So that can make it very difficult. So until we absolutely know it, you have to assign it as unknown, right? So that I'm guessing, but I think it's a relatively well-educated guess, that that's what's happening until they know for sure the person was vaccinated. And those would be reasonable types of situations that I would expect must happen every once in a while. Someone shows up with an ID that is not in the hospital system, is not in the government system, and they don't know, and the relative may not speak English, for example, to be able to clarify as to what the person's other names may have been when they got vaccinated. But in due course, they're pretty much able to figure out, I think, the vast majority of people, but not everybody. They're not able to. Sometimes we don't know. People live alone, for example, and they don't necessarily come in with their card, and yet they're very sick and get admitted to the ICU. So you don't have a chance to find out if they're vaccinated or not. They're all treated as unvaccinated in those situations till it's proven that they are vaccinated.
Doc, so just so moving forward before we let you go, because I'm sure you've heard the outcry in the people, and I think it's because they're kind of trained to think that when we see this kind of spread, which we haven't seen before, that there are measures that we did before that worked, and so when they don't see these measures being implemented, they will kind of run around like chickens with their heads cut off, just a lot of anxiety, not sure what the play is here. So just for the record, according to our conversation here today, you guys believe it's not so much the high number of positive cases because people aren't getting as sick. And so we're not really focusing on the positives. We're focusing on treatment and hospitalizations.
And vaccination.
I don't think that's too far off, Chris. It's saying that those numbers, while frightening, the focus is on doing what we can to protect the hospital while diminishing community spread at the same time, doing what we can to mitigate that community spread. It's both, and the predominant thing is vaccination. We know, Chris, unfortunately, that a huge number of vaccinated people are still going to end up being positive. And are we able to stop it? We hope we can slow it down. And we hope that the more 80% is good. I'd love it if we were at 100%, because then the vast majority of almost all members of our community would then expect to only get mild illnesses if they did turn positive. At most would be minor illnesses. Some get sicker. The vast majority don't if they're vaccinated. So it's those 20% that we want to try to convince for the good of the community, and for their own health, it's their choice. But for the good of the community, we're saying, please consider getting vaccinated. And for the good of their family, they'll be less likely to spread it to their family if they do turn positive, especially younger people who may feel that they themselves, and they're probably right, aren't at great risk if they turn positive. The average 20-year-old who gets COVID is probably the vast majority of them, nothing bad's going to happen. But, I mean, they'll get a minor illness. But we're saying, please get vaccinated so as to diminish the spread that you will be associated with if you do turn positive. Unvaccinated clearly spread it more readily. So we're asking them to help protect their own manumco in their family and their neighbors and the people who can't get vaccinated and the people with cancer that they might run into at the supermarket who are more vulnerable. Even though they are vaccinated, they're more vulnerable. People who are on steroids and others who may be more vulnerable. We're saying, please get vaccinated to help decrease the likelihood you're going to spread it to those people.
Well, thank you so much, Dr. Berg.
Yeah, I know you wanted to come on Monday too, but I know we went kind of long there. But
yeah.
I hope that this signals kind of like an open line of communication with you, as we know you're one of the.
Chris.
Okay,
it
good.
Does. I've
good.
been trying to get my bearings with this. I actually would on air tell you I apologize for not getting back to you, but I've gotten so many requests, and I've been just trying to help be part of the solution, and it's been difficult for me to get on air.
Course, yeah.
Much, but yes, I will try to make myself as available as I can, given, as you said, my crazy busy schedule.
Right.
Yep.
Okay.
But I'll do my best to be available, and hope that me being on air will help to at least provide some information that might not otherwise be available.
Right,
so I
right,
thank you for allowing me to do
of
this
course.
too.
Yeah, so
Thanks,
important.
Doc.
Thanks, Doc.
Okay.
Have a good weekend.
Have a good weekend.
Be safe. Right on. That's Dr. Nathaniel Berg. He's the new chairman of the Physicians Advisory Group, which is the body of doctors that advises the governor on, on the COVID, guys. So
He's got Dr. Hohen's job now.
yeah, he does.
Volunteer job.
Voluntold. I gotta take a break and I gotta process that interview because it was very revealing. Very revealing. It kind of sounds like we're doing the natural immunity thing, which means not focusing so much. And although Dr. Berg did say that they are doing their best to slow the spread, we all know that that's not happening. I mean, if you just look at the numbers, quite simply, it's not happening. But that's why they're not putting a lot of attention on the spread, is they're really trying to focus on the hospitalizations. And they believe that if the COVID spreads, well, some people are going to get sick, some aren't. Some are going to die, but they're probably going to be unvaccinated. So go out and get the jab, basically. But seriously, these measures, I just don't know. I thought that, in my mind, it's that the positives turn into the sick patients who end up going to the hospital. So preventive measures through the use of evenly applied restrictions kind of seem, I don't know, it just seems to me like that's a good way to prevent the positive cases. But in the words of Dr. Berg, and you guys heard what he said, I'm not trying to twist anything. You can go back and listen to the interview 10 times. But it kind of is implied that that's the play, is that it's everywhere, can't stop the spread, so let's focus on the treatment, which has been a little bumpy to stand up, and the hospitalizations, which have not decreased at all. They've only increased. And that's why, for me, listening to Dr. Berg's comments, and I know that, given the political ramifications of being a PAG advisor, that, the politics do come into play. But I just feel like he kind of upsold, right? It's like the way he was describing it. We're driving around in a Lamborghini, and I know damn well 2 tires just fell off when we pulled out of the parking spot. But that's just me. It's 9:04. We're going to take a break, guys, and let's talk tourism with former Governor Carl